Hey, welcome back into Fox 5's On the Hill live this Sunday morning. I want to switch gears now. Talk about veterans and health care. Close to 500,000 veterans who live in the DMV and some advocacy groups say the government is continuing to fall short for timely health care access at VA facilities and access to community care under fire. Jason Beardley is a retired Master Sergeant with Army Special Forces and a senior advisor to Concerned Veterans for America. Just first of all, thank you for your service. We always do say when folks like you join us. But this is a commitment that the government makes to its veterans. And throughout history, we have heard this story, whether you go back to World War II, to World War I, before that, pensioners who camped out on the National Mall. Why can't we get this right?
Well, first of all, thank you for having me. It's very tough, number one, because it's a federal agency, and the response is federalized. It's a big system. This is the second largest department in the federal portfolio. But when you're trying to reach out and touch veterans who live in rural communities or live in the outskirts, it's very difficult to be everywhere at every place. So part of what the law has said is, let's ensure that veterans are not stopped by having to be just inside the Veterans Affairs. Let them go into their local communities as well. That's the challenge.
It would speed up the care that they could receive, open up places they could go. What's not working about this right now, though?
Well, one of the things we Concerned Veterans for America have lobbied for is to make sure that we take the bureaucracy, the obstacles out of the way. What's not working is that inside the department, good people, right-intentioned people would rather have you come inside the VA. And sometimes that works great. There are plenty of veterans who love their care there, but what we've said at Concerned Veterans for America is when it works well, use the VA. But if it's not working well, if your wait times are delayed, then we should be able to use a local provider. That's what's not been working.
It's a massive budget, $369 billion budget. Right. The fact that you are still having veterans, though, and a new, younger generation of veterans who need this care out there after the wars in Iraq and Afghanistan, has that put more people into a system that was already struggling, you know, prior to the last 20 years?
Not only has it put more people, but the access is different. There are more things that you can be seen for. Of course, we're dealing with whether it's post-traumatic stress or whether it's physical things. And so, again, to really care for the needs and deliver health care at the remotest point in the country is difficult. You would have to have facilities everywhere. So the VA has struggled because it can't be there.
Wait times are something that veterans have talked about a lot, and you know, we have information about what these wait times have looked like right now. Primary care patients, you know, wait for 11 days. 11 days at Fort Meade, not far away from here. 70 days at Fort Belvoir. That's unsustainable for somebody who needs to see a doctor, who needs to see a medical professional.
Absolutely. The wait times are all over the place. And again, with the Law Mission Act, the choice was passed to say no more than 20 for primary care or 28 if it's specialty. But there are places where you're waiting, as you said, 70 days or 40 days or 50 days. Sometimes you can get there at the right time. But when a veteran is hurting and when a diagnosis needs to be met now, we can't afford to wait.
And we have some information. If somebody's out there who's been dealing with this, get a piece of paper, write this down, or at least take a picture of it with your phone. It's www.vamissionact.com. Now, people can get information about that. They can figure out ways to maybe assist them with, you know, this process, and it can be confusing and it can be drawn out, but people deserve this. And it's one thing to say thank you for your service. It's another thing to actually respond to it with good health care.
Yeah, we'd also like to let people know, come to cv4a.org, right. Find out how you can get involved, make the change.
Jason Beardley joining us live this morning. We thank you.